Hi, I'm Paige Little. I'm a Principal Research Fellow in Spine in the Centre for Biomedical Technologies, and I'm also the Research Director for the Biomechanics and Spine Research Group. An optimal patient position for spine surgery is vital for the surgery to be successful and to minimise complications during and after surgery. This is of particular importance when the surgeon is operating on children. Surgery to correct spinal deformity in children requires the patients to lie on their stomach. But when the patient has abnormalities in their body structure, such as a prominent rib cage or sternum, or other health conditions which make lying on their stomach unsafe, it's particularly difficult to position them safely and prevent injuries caused by prolonged pressure on the skin. At present, commercially available surgical positioning equipment is not adequate to protect some patients from pressure injuries, and medical professionals have to use ad hoc solutions such as gel pads or frames to protect the patient during surgery. We in the Biomechanics and Spine Research Group use state-of-the-art imaging technology and biomechanical simulations to understand how spinal deformity develops in children with scoliosis and to assist surgeons in creating contemporary treatments for these patients. We are using these same technologies to also explore adult spine biomechanics to better understand the ideal spinal position to enhance our sleep. So to tackle this surgical positioning challenge for young patients, we combined our current and new discoveries in paediatric spinal deformity and sleep biomechanics to develop an innovative digital workflow to create patient-specific theatre mattresses for patients having spinal surgery. So the workflow encompasses 3D imaging and simulation, biomechanical and movement measurements of patients, and a novel customised digital design workflow to create a mattress that can safely support each patient. Then our industry partners at Sealy of Australia apply a bespoke manufacturing workflow to produce the custom foam mattress for the patient. A patient-specific theatre mattress means that during lengthy surgery, weight can be taken off prominent anatomical features and children can safely undergo much-needed spinal deformity correction. So in 2018, Dr. Jeffrey Askin, a senior spinal consultant at the Queensland Children's Hospital, asked us to create the first custom-made support mattress for a 10-year-old patient who had an atypical anatomy and associated health condition who desperately needed spinal surgery. We immediately took the challenge, and together with Sealy Australia, engineers from the BSRG designed the first mattress, and Sealy hand-cut and pieced together multiple layers of soft, hypoallergenic foam to create this mattress that conformed perfectly to the young patient's anatomy.
The aim of the mattress is to prevent soft tissue compression problems associated with being under anaesthetic for long periods of time, having an operation. That's assessed by both the anaesthetists and the surgeons. Both during the operation, the anaesthetists need to administer an anaesthetic that is safe, that their blood pressure and respiratory function is all safe because there's a lot of pressure on the organs during the operation. And from a surgical point of view, that we can still do the operation despite the fact that it's a custom-made bed. So that's one way of assessing it, and that all went very well. We're very happy with that. And then secondly, at the end of the operation, when we look at the patient's skin, in no patient have we found any prominent bony areas that have been compressed by the mattress. In other words, there were no skin problems or pressure areas due to prolonged posturing. So that was successful as well. So overall, anaesthetically and surgically, and for the patient, they've been a great success.
After 17 successful spinal surgeries on patients from 2 to 15 years old, and even 2 adult patients in fact, we've successfully refined our workflow. While the initial design of the mattresses is a bespoke process, we see that it could be applied by orthopaedic or rehabilitative engineers to create customised support devices, not only for intraoperative care, but also post-operative support for patients of all ages with complex support needs. Our future projects will seek to use this technology for other types of surgeries and intraoperative positioning requirements in both children and adults. Our process is likely to be the first in the world, and through Sealy's international profile, our research will have reach and impact across Australia, New Zealand and the United Kingdom. This project is an example of the real-world impact of the Spine Group's research with Sealy of Australia. And to further solidify this great partnership, this year the QUT Sealy Centre for Biomechanics and Spine Research was established, and it's the first of its kind in Australia, and to the best of our knowledge, the first internationally. The already 6-year-long collaboration with Sealy Australia's International R&D Department gives us a strong foundation to take this research even further.
At Sealy, a key part of our product is making sure it's real and it's better and different, and a part of that is the research we do with QUT. And so with the establishment of the centre, we're able to embed kind of some of the work and the research here within our R&D centre, which really allows us to focus on product and like real world outcomes for our research. So the research insights are wonderful, but from our perspective we want to apply them into our product and into the real world, and that's a really key takeaway for us in our partnership with QUT.